Welcome back to the show. I'm hanging out with Jen Fanning. She is the Executive Director of Grand County Rural Health Network. How you doing, Jen? What's new?
Doing great. We've had a busy year, so all sorts of fun
Busy
things.
year with GC Rural Health, but also what's new locally? You know, what have you been up to? Been shredding?
Not yet.
It's been the endless powder day since our first snowfall.
Yeah.
And I have 2 runs in under my belt. You know, so I'm right there with you. I have not
Good
done a
for
thing.
you.
Yeah.
I'll be doing some shredding in the next few weeks, but
So
not
what are you
yet.
doing mostly in the winter? Downhill skiing? You know, cross country skiing, snowshoeing?
Downhill. For now, I have a 5-year-old who we're trying to teach how to ski, so because she's got to keep up with us, and she also likes to ice skate, so we'll be doing some ice skating locally as well.
Where do you go locally to ice skate in case someone's watching?
Fraser Rec Center has the icebox rink, I believe is what it's called.
It's an incredible rink. I mean,
It's
huge.
incredible, and the view is phenomenal. It's
a pretty rad state-of-the-art facility for our tiny little county here.
It's
Speaking
fantastic.
of rural, I mean, it's incredible for what we have.
It really is, and you can rent everything there. It's great and affordable. And then I hear tell that there's going to be a rink going up in Hot Sulphur Springs, which is where I live and work. So I'm excited about that.
That's really cool. And a quick free plug for Cooper Creek Square. You can also rent skates down at Christie Sports here in Cooper Creek Square. We have a little rink right next to the bus pickup drop-off. It's a great location. One more thing you can do while you're hanging out at Cooper Creek Square. But all right, Jen, let's hear it. Grand County Rural Health. Give us the quick overview. I know we probably touched on this last time you were here, but for any new watchers, definitely great to.
Sure thing. Well, we're a nonprofit here in the community. We're a health alliance. So what that means is we really work with all sorts of organizations and individuals who support your health. And our mission is we advocate for and support your health. And so health is many things. It's not just getting to a doctor, getting to a dentist, getting to a mental health provider. It's not just that and what you receive there. It's also what you eat. Where you exercise, do you have transportation to get there? You know, how much do you make, and does that allow you to get insurance and to pay for these resources? Do you have childcare and work and all of those things that make a person function? That's all encompassing of health. And so we work with all sorts of different organizations to try to make sure specifically our underserved here in the community get
not
what
to say
they
it's
need.
easy to be underserved, but we have our county population is 14,000 people. So we're not talking a huge population here. So I mean, you just covered a vast array of things, and to have all those services provided to only 14,000 people takes a pretty special effort.
It is. It's a coordinated effort, and that's exactly what we do, is really try to leverage existing resources with other organizations, what they're doing, and making sure that everybody knows what those resources are. For example, Grand County Council on Aging has transportation for seniors and the disabled, and can take them to the grocery store, to appointments, in and out of the county, things like that. So any people that come to our organization needing those services, we're able to then really work seamlessly with them. And that's just one example. You pick an organization, we work like that together and try to help everybody kind of see the bigger picture, and how do we not just create programs, but create bigger pieces, systems, if you will, to be able to affect change, to make it easier for people.
So, obviously, as we get into a more modern day society, is this common across the country? Are all rural areas like this? Or are we kind of special or unique in that?
You know, we were special and unique. We became a rural health network in 2000, and at that time, there was a rural health network, a national rural health network that helped support other rural health networks. And at that time, there weren't very many. We were like one of 2 in the whole state. Now they're popping up everywhere because people are realizing the value of working together, and really it takes a village. It takes a village to raise a child. It takes a village to help everybody in that village be healthy. And so that's what people are realizing, the special kind of niche that health networks have, and bringing all those different sectors together to kind of look at what needs to happen.
And so how would someone get involved in this? I mean, how did you get involved in this?
Sure. I was moved up here to be a ski bum for a season.
Like all of it. Where are you from?
All over. I'm an Air Force brat, but I
There you
moved
are.
from Colorado Springs.
Okay,
up
so your
here.
final stop is Springs, then you moved up
Yep,
here to
then I moved up
do
here.
like many of us did, come ski bum for winter and just check out the wild lifestyle.
And then I was too poor to leave. I couldn't leave, so I stuck around for the summer and realized, holy moly, the summers are amazing and I want to stay here. And, did odds and ends jobs and had folks say, you're really interested in the health. That's what I've done in the past. Like, you should work with public health or the Rural Health Network. And so I started kind of poking my way in there.
And what year did you say the Grand County Rural Health got started?
We formally became an organization in 2000 and became a nonprofit in 2001.
And you started with them when?
2007.
2007. Okay, so you've seen a lot of changes and growth within
significant growth
in your 9 years.
Absolutely.
So as locals, how do we use it? Like,
sure. So I would say there's a couple of ways specifically to use our services. We have some programs if you don't have insurance and qualify financially, and I would say that there's you think you might not qualify financially, a lot of people do, because we know that it's difficult to afford healthcare. We have vouchers that help you get in to see the doctor of your choice, for children to see the dentist of your choice, and for both adults and children, a mental health provider of your choice. So it's not insurance, but it helps you get in.
it's like a coupon?
Yeah.
Okay.
Yeah.
But
it's
it'll
a coupon,
allow
and we
you to
pay.
get in and get what you. Okay, so I see. So that's kind of covered by you.
Yep, exactly. We pay the provider directly.
Do they find you on your website and apply, or their doctor recommend them to talk to you, or
Yep,
kind of
the
everything?
doctors are points of entry. At the schools, the school nurses are points of entry. Public health, most nonprofit organizations, they may not be points of entry, but can help kind of coordinate that. So that's one good way. Another good way is, the healthcare system's really, really confusing.
You know what? On that note, we're going to take a quick break.
That sounds
great. And we'll come
great.
back because the healthcare system is really confusing. So we're going to come back, talk a little more nuts and bolts on rural healthcare and what struggles we face locally. So once again, hanging out with Jen Fanning, Executive Director of Grand County Rural Health, gcruralhealth.com.
That's correct.
Nailed it. We're going to be back in a moment.